Well, good morning, and thanks to all of you for joining us. I know this is a little bit earlier than you're used to tuning in, but this afternoon, at our normal time for these events, we are welcoming First Lady Dr. Jill Biden to Richmond. She's visiting the Massey Cancer Center at VCU, and we're honored to welcome her on her first trip outside of Washington as our First Lady. Today, I want to talk about vaccinations, the Federal Pharmacy Partnership, and the next steps for slowly easing a few of the current mitigation measures, which we were able to do because cases are falling and vaccinations are rising. So let's talk about three different numbers. First, the number of cases. Today, our daily new case average is 1,708. The lowest it's been since before Thanksgiving. Second, let's look at the number of vaccines. We've administered almost 1.7 million doses overall. More than 1.1 million Virginians have received the first dose. That's about 13.5% of the population. Our daily vaccine numbers are down temporarily because of delays from winter storms, but before that happened last week, we were averaging about 36,000 shots into arms a day. This is a big week, this week, for getting shots in arms. Last week, President Biden's administration announced a bump in vaccine allocations from states. And winter weather in Virginia and beyond last week meant that vaccine shipments were delayed and a number of vaccination clinics were postponed. Now those shipments are coming in and our health districts are working to get them in arms just as fast as possible. Bottom line, our health districts are out there getting vaccine into arms, like I said, as fast as we can. Virginia has been a leader among states in getting people vaccinated, and we will keep that trend up. This week, there are about 220 vaccination events around the state. So third, let's look at the numbers at our new call center. Last week, we launched a new statewide pre-registration system so that any Virginian can sign up online at vaccinate.virginia.gov. or by calling 877-VAX-INVA. Since that launched, almost 500,000 Virginians have pre-registered. This is great news. The system is working and it is meeting a much needed effort. That is on top of 1.2 million Virginians who had previously signed up with their local health department. So we have 1.7 million Virginians now pre-registered. And the call center has received more than 100,000 calls so far. And as I said last week, the call center is in English and Spanish, and we have a call-back program that covers about 100 different languages. If you're one of those folks who pre-registered through your local health department, you don't need to sign up again. You can check your status at vaccinate.virginia.gov. And if you have questions, again, you can call 877-VAX-INVA or 877-829-4682. Now, let's talk a little bit about where these shots are available. I mentioned that the Biden administration boosted vaccine allocations last week. They also increased the number of vaccine doses going to pharmacies in the Federal Pharmacy Partnership. That means more pharmacies are coming online this week to start giving shots through that federal partnership. CVS started vaccinating Virginians at certain locations a couple of weeks ago, and Walgreens will start later this week. In addition, Walmart, Albertsons, which owns Safeway, KVAT, which owns Food City, RBS, which owns Giant, and a network of independent community pharmacies are all coming on board to start vaccinating eligible Virginians. They'll share a federal allotment of the Moderna and Pfizer vaccines. Now, not all of the locations for each of these companies will be receiving vaccines. Locations are decided by the companies in consultation with our Virginia Department of Health to focus these efforts on high-risk and vulnerable communities. And Walmart plans to hold vaccination clinics at off-site locations that our Health Department and Department of Emergency Management help to choose. So Walmart won't be vaccinating in its stores at all. So please don't go there looking for a shot. They'll be out at community sites. The great thing about this is off-site mass clinics will allow Walmart to vaccinate a few hundred people a day. And it will allow them to choose different locations each week based on need. All of these pharmacies will prioritize those 65 and over. And all vaccinations are by appointment only. So again, please don't just show up, but go onto our website or make the phone calls and make sure everybody can get registered. A couple of weeks ago, CVS became the first pharmacy in the federal partnership to start vaccinating in Virginia. We've had conversations with these additional pharmacies about working with our pre-registration system. And they're all willing and interested in working together. But there are still some technology barriers. Some pharmacies are able to work with our pre-registration system online, but others are not. So we're putting creative solutions in place. This week, the call center is making outbound calls to schedule appointments for Walmart and Giant. Call center workers are calling people in Virginia's pre-registration database. So when your phone rings, you need to please answer it. We expect to expand this effort next week and beyond, with the call center setting up appointments for other pharmacies using the VDH pre-registration database. We're also working to connect these pharmacies with the state's list. We're encouraging health districts to share their wait list database with the pharmacies. These partnerships are expanding very quickly, and the majority of pharmacies in this federal partnership will work with our system, and that's a good thing. We're doing everything we can to ensure that Virginians who signed up with the VDH list are in line for pharmacy appointments. I'm glad that these pharmacy chains are willing to work with us, and I'm grateful that this federal partnership puts an additional 52,000 vaccine doses per week into Virginia's arms. We're also grateful this week to the Federal Emergency Management Agency, or FEMA, which is allocating $179 million to Virginia to help cover costs to identify and set up future mass vaccination sites. We're not currently hosting those sites, but we don't want to wait until we have enough vaccine supply to do so to start the planning. We will be ready as supply expands. But we do expect to see vaccine supply increase soon, in part because, as you all probably heard on the news, Johnson & Johnson vaccine is likely to get approval from the FDA. Just this morning, FDA staff confirmed that the vaccine is safe, and we could see doses come into states as soon as next week. That is great news, because that will allow us to vaccinate more people and get closer to, as you all have heard us talk about before, herd immunity. So starting next week, just to summarize, we'll have 3 vaccines in Virginia that are safe and effective: Johnson & Johnson, Moderna, and Pfizer. All of these vaccines are shown to reduce serious illness and death from the virus. People ask me, what's the best one to get? Well, I would sum that up by saying the best vaccine is the one you get. Now, I'd like to talk about trends that are making it possible to ease some of the mitigation measures that are now in place. Last year, to slow the spread of the virus, we put limits on how many people could be together at various events or in certain places of business. And it worked. As our COVID cases and hospitalizations went down, we slowly raised those limits through phased reopenings. But as the cold weather and holidays approached, cases started getting higher than ever before. So we took the sensible step and reintroduced some of those mitigation measures, limits on social gatherings and a curfew, for example. Now, almost 2 months past Christmas, and with thousands of Virginians vaccinated, we're finally seeing COVID numbers fall and vaccination numbers rise. That means we can start to consider how to slowly, safely ease some of the measures we put in place before the holidays. So here's what that will look like starting this Monday on March the 1st. We're going to expand alcohol sales to midnight. As you know, previously they were to close at 10, so that will go to midnight. And we will the modified stay-at-home order will be lifted. So no more curfew from 12 to 5, but I still would encourage folks after midnight to please be at home. We're able to ease restrictions on outdoor gatherings. Outdoor social gatherings can have up to 25 people, up from the current 10. At outdoor entertainment and public amusement venues, the limit will move from 250 people to 30% with a cap of 1,000 people. Now, if the trends continue as they are, cases down and vaccinations up, I would expect that by April, we could be able to continue the 30% measure, but remove the 1,000-person cap for outdoor venues. We will be working with venues to strengthen their ability to implement safety measures. And we hope that with trends continuing as they are, that we can look at further steps in the coming months. But it's critical that we do this slowly and thoughtfully. Monday, as you all know, is March the 1st. It will be just 6 days shy of a year since the first positive COVID case was identified in Virginia. And we have come a long way since then through a very, very tough time. And we do not want to risk our progress by easing restrictions too quickly. Not now, when more and more Virginians are getting the protection of vaccines, and not when variants that can infect more people more quickly are spreading. We're at a dangerous but very hopeful moment, hoping that we can spread vaccinations faster than the variants, and I believe that we can. For now, everyone needs to continue doing the things that we know work: social distancing, wearing a mask, and washing your hands. Finally, while we have focused on COVID and vaccines, the General Assembly is wrapping up its final week of session. Together, we have made important progress on major issues: ending the death penalty, getting children back into the classrooms, expanding voting access, legalizing marijuana, and much, much more. I appreciate the work that the legislators have done, and I look forward to reviewing the legislation that they approved when it gets to my desk. So thank you, and I'll be glad to take your questions.